So next up, we're going to tackle the pelvic girdle. So the pelvic girdle is going to be the articulation. So basically what's happening is the lower extremity is attaching to our exoskeleton through this joint here. It's the articulation of the pelvis with the sacrum. So I know we didn't spend a lot of time on the sacrum. The main thing I want you to know about it is that it is going to form that junction between our exoskeleton and our lower extremity. So another joint we want to focus on is the femoral acetabulum joint. So you can see on Skelly, the head of the femur is actually articulating with a really deep socket called the acetabulum. Other things we can see from this view are the three regions of the pelvis. So when we look at this on a model, we're not going to have the articulation here. We'll have just the right and just the left pelvis, but not united together. But this is really nice for orienting ourselves. So from a lateral side, you want to look for the acetabulum to know left versus right pelvis. And then we're going to use the three regions of the pelvis to help us know anterior from posterior. So posteriorly, we have the iliac region. This is going to have our iliac crest. We're going to have two anterior attachments and then two posterior attachments, and then we'll have some spines down here. All good things that are going to be muscle attachments. So that's all iliac region. Anteriorly, or most anteriorly, we have our pubic region. So that's going to be kind of this anterior half that you see. And then posteriorly, we're going to have our ischium. So Skelly's femur is in the way here, but this part, this roughened area, that's part of our ischium. So let's look at that on our disarticulated pelvis. So what we have here, right pelvis, or os coxa as it's sometimes called, and left pelvis. And the way we know that is the acetabulum is always lateral. So this is an anterior view of our right pelvis. Let me get the femur out of the way. So again, we have iliac region up top. This is our iliac crest. We're going to have pubic region mostly anteriorly, and then we'll have our ischium. And kind of the border between these is going to be our acetabulum. So this is kind of where all three regions unite to form that joint socket. Okay. So let's talk about structures of the pelvis. So we've talked a little bit about the iliac crest. That's going to be this very prominent crest. It is really easy to label, so you might see it on the lab exam. And that's going to follow all the way to its termination at the posterior superior iliac spine, PSIS. We're going to look at that from a posterior view. It'll be a little more clear. So that was iliac crest. Of course, we have our acetabulum laterally. We're going to have two bumps anteriorly. So remember, pubic region is anterior. So bump 1, bump 2. This is going to be our anterior superior iliac spine. It's a spine, it's pointy, it's anterior, it's superior, it's part of the ilium, so it's our ASIS. This is our anterior inferior iliac spine. So the first two words are going to refer to directions, and then this is an iliac spine. Okay, let's take a look posteriorly at their counterparts. So posteriorly, we're going to have a posterior superior iliac spine, which is much more gentle here than it was anteriorly. But this little bump, kind of this termination of the iliac crest, that is going to be our PSIS. And then we have our posterior inferior iliac spine. So again, it's just a little pointy bump here, a suggestion of a bump, but PSIS, PIIS. Additionally, we have this huge notch here. This is our greater sciatic notch. So the sciatic nerve, largest nerve in the body, is going to run through that sciatic notch. What else can we see here? And what am I going to ask you? We haven't talked about this opening here, this foramen. This is going to be our obturator foramen. And we'll talk about the obturator internus and externus. Those are two muscles that will come up in just a couple of labs. Anteriorly, we can talk about the pubis. So we have the body of the pubis, which is going to be like this main portion here. We are going to have some rami, so we have the inferior ramus of the pubis. So notice the change in angle here. We're running this way, and then inferior ramus is going to run more vertically. So anytime we have a vertical change like that, it's going to usually called a ramus. And then we turn into the ischium. So kind of this division here, this is all pubis, this is all ischium. So this is going to be our ramus of the ischium, and then it takes a sharp turn here. So now we're more vertical. And the most important thing about the ischium to know is this roughened area. This is your ischial tuberosity. So very important attachment point for the hamstring muscles. So definitely want to bookmark that one. It's good to ask on a lab exam. It's good to ask when we get to muscles as well. Okay, let's see if I missed anything here. Okay, we talked about the greater sciatic notch. Ooh, last one here. This guy. This is the spine of the ischium. So again, it's pointy. It's going to be a spine. It's in the area of the ischium. So it's going to be the spine of ischium. You can say ischial spine. That is perfectly acceptable. So I think the most important thing about studying the pelvis is going to be orienting yourself first. So a lot of people get mixed around. Find your acetabulum. This is how we know it's lateral. Find your pubis. This is always going to be most anterior. And then iliac region is more posterior. And this is going to help you towards identifying, your anterior spines versus your posterior spines. If we flip it over, looks a little different now. So let's reorient ourselves. This is our pubis, so we're kind of looking at a mid-sagittal view right now, cutting through the midline of the pelvis. So we still have our ischial spine terminating in the anterior superior iliac spine. We have additionally an iliac fossa. So let me tilt this just a little bit. This is our iliac spine. This whole shallow depression is going to be a fossa, very similar to the scapular fossa, the 3 fossa we talked about. So this whole thing, iliac fossa, yes, there will be a muscle associated with the iliac fossa. And that is everything that I would potentially ask you. So there are a couple things with the pubis that I'm not going to ask you on the lab exam just because it's hard to ask without the articulated pelvis here. But just in case you want this for additional context, when we have 2 pelvis articulated, the crest here formed by the pubis, that is called the pubic crest. So it's best seen when we have that articulation. So I'm not going to ask you it on the lab exam.